we were discussing intercostal space, right? So we are finding like there are the spaces found between the ribs. So we have 11 pairs of such intercostal spaces, right? So now let us see. So what do we have there? So we have muscles, vessels, and nerves. So I was telling like we have 12 pairs of ribs on each side, and in between them we have 11 intercostal spaces. And in each space we will see intercostal muscles, we will see band structures, intercostal vein, intercostal artery, and intercostal nerve and lymphatics. Okay. Now when you look at this picture, you see, so this is the rib above and this is the rib below. So between the two ribs, in three planes. The one which is outside is external intercostal, the one which is in between is internal intercostal, and the one which is innermost, that is the innermost intercostal muscles. Okay, they are supplied by these nerves which you are finding, which are close by. These are the intercostal nerves. Okay, now the action of these intercostal muscles, when we have studied respiratory system in physiology, the action of these muscles is to pull the ribs nearer to each other, okay, and they strengthen the tissue in the space. Basically, they help in respiration. Okay, now let us see the first muscle. Each muscle you have to describe. So the first muscle, which is the most superficial one, you can see here, this is external intercostal muscle. So the most superficial one, you can see the direction of fibers, it is directed like this. As you keep your hands in the pockets of apron, something like that it is, you are finding the direction of the fibers is downwards, forwards, and medially near to the midline. Sternum you are finding. The origin, now see, this is the lower border of the rib above is the origin. Fibers are running downwards and then it is getting inserted into upper border of the rib below. Upper border of the rib below. Lower border of the rib above is origin, comes down, gets inserted into upper border of the rib below. Okay, that is. Now basically this muscle is not present anteriorly, it is deficient anteriorly. Here we will have only intercostal membrane. We do not have muscle fibers. Now second muscle, once you remove that muscle, once you cut off that muscle, you will see in the second plane, we have internal intercostal muscles. Here if you see the direction of fibers, they are directed downwards and backwards, not towards sternum, away from sternum, see the direction. Okay, laterally, that is origin. See, when you see the structure of rib, in the rib there is a groove called a subcostal groove. So it comes from the subcostal groove and then it is coming to the upper border of the rib below. Same thing like what we studied for external. See, external is cut and you are seeing the internal one now, like that. Okay, so this is deficient posteriorly. External was deficient anteriorly, internal is deficient posteriorly, where you will have posterior intercostal membrane. Now you can see the muscles here. The first, see, this whole thing is rib, okay, where it takes a sharp bend, you call it as angle of rib. And the rib, basically it is made up of bone, but in front the one which articulates with the sternum is made up of cartilage. Okay, so costochondral junction it is called as costochondral junction. Okay, you can see the muscles, like we have outside is external intercostal muscle which is deficient anteriorly, behind is the internal intercostal muscle, it is deficient posteriorly. Okay, like that. Now the third muscle which is present in the most deep plane, deepest layer, we have innermost intercostal muscle. Okay, and again Niharika, if you want you can just share that photograph better. Okay, there is one table in
Difference, ma'am.
there is one table in the first lesson, like intercostal space in the thorax of Jurasia. There is one table which gives us origin, insertion, nerve supply, action of these muscles. Okay, so you can learn from that table. You can later share when I ask you, and you can share in our group. Okay, so
Yes,
innermost
ma'am.
intercostal muscles. See, this is in the last plane, the innermost one. So this is also incomplete layer. So it is divided into three portions. Okay, so if you remove now, see one below the other. First muscle was external intercostal. Second is internal intercostal. Third one is innermost intercostal. Okay. Then you will have, there is one fascia inside. You call it as endothoracic fascia. Endothoracic fascia. Okay. Deep to the endothoracic fascia, you will have lungs, parietal layer and visceral layer of the lungs and the lung tissue. Okay. That is. So, like in the subcostal groove, we have vein structures: intercostal vein, intercostal artery, and intercostal nerve. So now coming to the intercostal nerves. Now, between the vertebrae, yesterday I told you we have 12 pairs of thoracic nerves, 8 pairs of cervical nerves, 5 pairs of lumbar nerves, 5 pairs of sacral. Similarly, now see here, between the thoracic vertebrae, you are finding nerves are coming out. So these nerves are actually called as intercostal nerves. Okay, so how many pairs we will have? Such 12 pairs of thoracic nerves are there. Okay, so their anterior primary rami, the ones which are moving anteriorly, they are actually supplying the thoracic cage. Okay, so they are numbered 1, 2, 3, 4, 5, 6 till 12. So 1 to 6 they are distributed in the intercostal spaces. 7th to 11th, they not only supply thorax but also supply abdomen, anterior abdominal wall. 12th one, the last one, is going and supplying exclusively abdomen only, doesn't supply thorax. You call it as subcostal nerve. Subcostal nerve. Sometimes intercostal nerve may be asked. Now, in our textbooks, whether it is Chaurasia or whether it is Vishram Singh, this picture is given. But I'll try to make you understand. And you are supposed to draw this picture if it is coming for your exam. Don't read anything. I'll try to make you it very easy. See, this is the thoracic vertebra. Inside the thoracic vertebra, spinal cord is passing. This is the spinal cord. You can see gray matter, white matter, right? Now, if from the intervertebral foramen, you see spinal nerve is coming. No, so this is our spinal nerve. So it is coming and it is moving towards the sternum. That means it is running between the ribs and it is supplying the intercostal muscles. No, so now let us name the muscles. What is the first muscle outside? What is the name? External intercostal muscle. Okay, we know it is deficient anteriorly, this green line. We don't have muscle fibers anteriorly. Then the second muscle we have internal intercostal muscle, this one. Then we have third muscle, this is innermost intercostal muscle. So if you see the course of the nerve, it is running between which muscles? Second and third muscles, internal intercostal muscles and innermost intercostal muscles. It is running like this and then it is giving one branch which is piercing the external intercostal membrane and supplying the skin. Okay, so and if you just see throughout its course, it is giving one branch which is moving outside, it is giving a branch which is moving like this, collateral branches, many branches it has. Okay, now what are those? See, the branches are rami communicants. These are the rami communicants which are named. Okay, then collateral branches. Sidewise branches, what we see, they are actually called as collateral branches. Okay, lateral cutaneous branch is this. This is the lateral cutaneous. Anterior cutaneous branch is this. From front, it is coming and supplying the skin. Anterior cutaneous branch. And so many twigs are going and supplying these three muscles. These three muscles. They are called as muscular branches. And the branches which go deep inside, we have endothoracic fascia and pleura, no? So those are pleural branches. And the last ones, they are going and supplying abdomen also, right? So that is, they are supplying peritoneum. In the abdomen, we have peritoneum. So 7th to 11th are peritoneal branches. Okay, so these are intercostal nerves. Like in each space, we have 11 spaces and then 11 intercostal nerves. 12th one is subcostal, the last one. So these are mixed nerves. That means they have sensory nerve fibers and motor nerve fibers. That's why they are called as mixed nerves. Okay, they supply skin, muscles of intercostal space, parietal pleura in the thorax, and parietal peritoneum in the abdomen. So in your textbooks also good pictures are given, but practice the diagram and give this information. Okay, this is one more picture you can see. This is thoracic vertebra, spinal cord, spinal nerve is coming. It is running between external intercostal muscle. This is internal intercostal and this is innermost intercostal. And this is the course of the nerve. Okay. Then, so these are its branches we have. This is the dorsal ramus. We have collateral branches, lateral cutaneous branches, anterior cutaneous branch we have. Okay. Then, now, apart from this, if you observe here, see in the intercostal space, not only nerve is running, but along with nerve, artery is also running in each space. Vein structures, no vein, artery, and nerve. Three are running, one below the other. Okay, vein, artery, and nerve. So you are finding from the aorta, you are finding the posterior intercostal arteries coming. You remember, like there is one artery which runs like this. We have studied that in the thoracic cage, supplying mammary gland, internal thoracic artery. I told you in each space it gives two arteries. Okay. So intercostal arteries, in each space we have one posterior and two anterior. We need a little good picture to understand this better. Now see here, this artery we have studied. Do you remember? Internal thoracic artery, also called as internal mammary artery. It's a branch of subclavian artery. In each space, this internal thoracic artery gives two anterior intercostal arteries. You see, one artery is this and one artery is this. So anterior intercostal arteries are two in number. Here also, in this space also two. In every space two. When I said this internal thoracic artery, also called as internal mammary artery, it divides into two. It is bifurcating in sixth intercostal space. Here it is bifurcating. Here it is bifurcating. Okay. It is bifurcating into superior epigastric and musculophrenic. I hope you remember this. We have discussed in our previous classes. So from the musculophrenic space, like 7th to 11th spaces are supplied. First six spaces are supplied by direct internal thoracic. 7th to 11th, they are supplied by musculophrenic. This is anterior intercostal. Now, behind also we have one artery. This is only good picture to understand better, this one. See, this is behind, no? Behind from the aorta, we have one artery in each space. One artery. From aorta, we have in first space one artery. Behind we are talking, not in front. In front we have two arteries. Behind we have one artery. Okay. So I'll try to share one internet picture also to make you understand. So I hope you are seeing the screen now. See on the screen you are finding this is arch of aorta. This is thoracic aorta. From the thoracic aorta, if you see on either side, see we have 11 intercostal spaces, right? So 11 intercostal spaces, you will have in each space one artery is entering. So that is posterior intercostal artery. So posterior intercostal artery is coming from aorta, okay? Whereas anterior intercostal artery, from where is it coming? See here, anterior intercostal arteries, they are branches of internal thoracic artery. It moves like this. In each space, how many arteries you are finding? Two, 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 two in number. Okay. Each anterior intercostal space contains two anterior intercostal arteries. Okay, upper six pairs arise from internal thoracic, whereas the lower seventh, eighth, ninth pairs they arise from musculophrenic arteries. Okay, so like that you will see in each space anteriorly we have two arteries and posteriorly we have one artery. Okay, this is very good picture which is given in your textbooks also beta. So I want everyone to practice this diagram. So see here now because you got a concept now it becomes clear. See this is the aorta, thoracic aorta. So this is right posterior intercostal artery. This is left posterior intercostal artery. The posterior intercostal artery is actually dividing into two. Okay, there is main branch and collateral branch. See, the lower branch is collateral branch and this is the main trunk. The main trunk comes and anastomosis with superior intercostal artery. Collateral branch comes and anastomosis with inferior intercostal arteries. Anteriorly, how many arteries are there in each space? Two. This is anterior. In anterior, you have two arteries. Two. This is anterior. Two. Posterior only one, but it divides into two in order to anastomose with these two. Main artery is anastomosing with the superior one, collateral branch is anastomosing with inferior one. Okay, like that you try to draw the picture, and from the main trunk you are also finding the branches which are moving towards the body wall, they are cutaneous branches. Okay, posterior arteries are there. Okay, in your textbooks also this picture is given. Okay, Rohita, did you understand?
Yes, ma'am.
So that because those pictures may not help you, I thought I will share this picture. The theoretical aspects will be like the point where you are supposed to focus. So now this is our intercostal arteries. Picture is not that clear what I have shown you from the net. So each space you are finding one posterior intercostal artery and two anterior intercostal arteries, isn't it? So posterior intercostal arteries, they are actually like in lower, like they are coming from the thoracic aorta, and anterior they are coming from the internal thoracic. Last five they are coming from musculophrenic. Then corresponding to the arteries, we have intercostal veins also. This is azygous system of veins, if you remember. This is azygous. We have
Antis.
hemiazygous and accessory hemiazygous, isn't it? So finally, all azygous system will be draining into superior vena cava. Okay. So if intercostal veins is asked, better you talk about azygous system of veins. Okay. So lymphatics, nobody will ask you better in the intercostal space, but still if it is asked, you can write anteriorly, the space is draining into anterior intercostal nodes, posteriorly it is draining into posterior intercostal nodes, that's it. Now coming to the applied aspects, intercostal space. So sternum is the place which is usually used to do bone marrow biopsy. Okay, sternal angle is also called as angle of Lewis, which is the junction of manubrium and body. That is sternal angle, which is very important landmark for counting ribs. Okay, cervical rib is sometimes extra rib may come from seventh cervical vertebra. That's what is called as cervical rib. Basically, we have 12 pairs of ribs now. From neck, if rib comes, you call it as cervical rib. Okay. So there may be some traumatic injuries also in thorax where the rib cage may be fractured. Okay. So pleural tap is a technique where we are generally inserting the needle in the intercostal space and we are collecting the fluid. That is pleural tap. Okay. So here also you can see how the drainage tube is kept. So that is all about intercostal space. So actually lymphatic drainage and venous drainage itself takes 1 hour, but it's a very lengthy topic. I'll take tomorrow. And what are the other things we have? Okay, from the question paper which has been shared, let's see. Um, Niharika, do you want me to explain something with anal canal? I have explained you very nicely. 1 full hour I have taken this class. Bronchopulmonary segments also, common bile duct, anomalies. This is embryology. So as major to is coming very much regularly. Meiosis classification terms. What are the supports of uterus? Perineal body, pelvic diaphragm. Then we have certain ligaments, no? What are those? Anteriorly we have pubocervical ligaments, lateral cervical ligaments, then uterosacral ligaments, isn't it? Perineal body, what are the 10 muscles we have in perineal body? Superficial transversus perineal 2, deep transversus perineal 2, bulbospongiosus 2, then we have the levator ana 2 in number, then external anal sphincter. All these one common point, meeting point, that is perineal body. Pelvic diaphragm, what are the muscles we have? Levator ani. What are the components? Iliococcygeus, ischiooccygeus, pubococcygeus. Broad ligament is not a true support. It's only false support. It's an arbitrary support. Suprarenal gland, blood supply. Three arteries are there, beta. Superior suprarenal, middle suprarenal, inferior suprarenal. Superior suprarenal is coming from inferior phrenic artery. Middle suprarenal comes directly from abdominal aorta. Inferior suprarenal comes from renal artery. So three set of arteries. In adrenal gland chapter, you will have a very good picture, beta. Blood supply of suprarenal gland. Okay. Classification of bones also we discussed by making use of PowerPoint. Can you tell me what are the bones we have? Long bones, short long bones. Long bones are like humerus, femur, which has upper and lower end and shaft. Short long bones are like we have carpals, metacarpal, small bones, but still they have upper and lower end and shaft. Then we have irregular bones. Hip bone is irregular bone. We have sesamoid bone, which is the largest sesamoid bone, patella. It is developed in the tendon of quadriceps femoris, isn't it? And what else? Better? Irregular pneumatic bones. Air-filled bones are called as pneumatic bones. We find pneumatic bones like frontal bone, maxillary bone, ethmoid bone, sphenoid bone. Okay. Then meiosis. Meiosis is a type of cell division which we see only in case of ovaries and testes. Okay, when spermatogenesis and oogenesis is taking place, you will see the chromosome number of the cells will be halved. For that purpose, meiosis will take place. So you have certain specialized stages. No, what are those? Leptoteny, zygoteny, pachyteny, diploteny, and diakinesis. We have various steps with the help of which you will see the chromosome number of the cell will be halved. Okay, that is meiosis. Common peroneal nerve. This is one of the terminal division of sciatic nerve. In popliteal fossa, you will see sciatic nerve will be dividing into two, isn't it? Common peroneal and tibial nerve. Common peroneal will come laterally at the neck of the fibula. It will divide into superficial and deep peroneal nerves. Superficial peroneal nerve supplies lateral compartment of leg. Deep peroneal nerve supplies anterior compartment of leg. So suppose if this peroneal nerve is damaged due to fracture of neck of fibula, person will suffer with foot drop. Okay. So as major muscle, from where does it come? The lumbar vertebra. It is seen in the posterior abdominal wall. Then it is getting inserted in the lesser trochanter, isn't it? Nerve supply comes from the lumbar plexus. Developmental anomalies. Histology of pancreas, we will see acini, which are exocrine part. Then we have uh, endocrine part is islets of Langerhans, where we have alpha, beta, delta cells and their specialized functions. Common bile duct, how is it formed? Cystic duct and the right and left hepatic duct, they both join to form common bile duct. Bronchopulmonary segments, anal canal. Okay. So, Niharika, you remember anal canal, beta? It is subdivided into three. Overall, how much is the length of it? Into how many subdivisions? You see, it is divided into upper one third, middle one third, and lower one third. Isn't it? Do you want any of the topic to be repeated properly, beta? Because all these essays I have taken like 1 hour lectures for each. In fact, anal canal, bronchopulmonary segments. Nobody is speaking. Puram, you know these answers?
Which one, ma'am?
Anal canal,
Yeah, ma'am, I studied it. I have to revise again.
okay. Bronchopulmonary segments.
Yes, ma'am.
You bronchopulmonary segments. Did you study this answer?
Yes, ma'am. Yes, I know. I know. I learned it by mnemonic, ma'am.
Oh, nice, very nice. The material what you have shared is actually very good. The drawback what I found is diagrams are missing, beta. The diagram part you have to correlate with the textbook. Don't miss it. Otherwise, passing out.
Ma'am, otherwise the content is good, right, ma'am? Only the diagrams were missing in that.
Ah, yeah. Only diagram part is missing. Theory part, all of you can read from those books. Very nice.
Like, ma'am, for exam, I'm learning from that and practicing. Is it okay, ma'am? That material?
100%